Hello and welcome to On Second Street. Today we're talking about some innovative changes that we're seeing happening in healthcare that can improve access. And my first guest is the CEO of a company called Medimap, Thomas Jankowski. Thank you so much for taking a few minutes to chat with us today. I'm wondering if you could maybe, Thomas, just start off the top. What is it that your company does and how does that help patients in Canada?
For sure. And thanks for having me, Colin. So, Medimap is the only online healthcare marketplace that connects patients with doctors and basically matches them perfectly and provides them with a list of facilities that can address their symptoms, their issues, optimized for availability.
So one thing I noticed with your site that I thought was very handy is if I live in, say, Calgary or Toronto or somewhere else in the country, I think a lot of communities, you can go on the site and see the wait times for different clinics. So I might know that, if I go to this clinic, I might be looking at an hour wait, whereas if I go over here, it's 2 hours or whatever the case is. Could you tell us a little bit about how you get all that data, how it works, and so forth?
For sure. So we get this data in a number of different ways. Usually it's provided to us by the actual clinics through software that we have integrated into their practices. It's quite accurate in many cases, and it does allow for, like you said, that sorting by availability, which actually makes it really useful for both patients who don't have to just randomly, call a clinic or walk into a clinic just to face a very long wait time, but it's also a useful tool for the doctors and the owners who don't have to face, a mile-long line outside of their clinic if there's a clinic nearby that has no wait time.
And I can imagine for the doctor's perspective, patients are probably a lot more pleasant if they've only been waiting, say, a half an hour rather than 2 hours when they finally get a chance to meet with a doctor. Um, before we started, you had mentioned that your site also helps connect patients with other medical professionals who they might not intuitively think about that can help them. Could you just tell us a little bit about how that might work?
For sure. So, starting really with last year, there's been a lot of changes to the scope of practice for both nurses and pharmacists all around the country. And there are many, many different illnesses for which they can provide assistance as well. So, if you're thinking of typing something like doctor near me or clinic near me, you might only see places that are powered by doctors, so to speak. But if you come to Medimap, we'll actually list places in many situations, actually a local pharmacy where you can get the help you need in matters of moments as opposed to driving somewhere and waiting for hours.
And so when we think about the big picture, how many different clinics in Canada are actually part of your network?
Right now on Medimap, we list about 120,000 clinics, many of which are on our freemium model, but there's also, several thousand paying clinics as well.
And those are all in Canada?
That's right.
Oh, okay. I had no idea the number was that high. So what would be the breakdown then between, say, doctor's offices versus like a pharmacist that can help, or maybe an office with a nurse practitioner or whatever? Do you know roughly what the split would be?
So when you think about primary care, I think the split is still significantly in favor of walk-in clinics, staffed by doctors, probably on something like a 70-25% split in favor of doctors. And then the 5% would be nurses that are still, still don't see that many clinics staffed by nurses only, mostly because of some regulatory challenges. And
Hmm.
then in the allied health space, so when you think about stuff like massage, physio, mental health, which we also help with, that's 100% doctor driven right now.
Oh, okay, that's interesting. I didn't realize you were in that space as well with physiotherapists and massage services and so forth. That's interesting. When it comes to the clinics that I'll say walk-in clinics that have signed up and they're part of your company's network, do they tend to just be private clinics and maybe nonprofit, or do you have any government-run facilities that are part of your network?
Um, it's mostly public clinics. Some private as well, but publicly funded at least. And then
Hmm.
there's one or two hospitals that also started using our services in a limited capacity.
Oh, okay, well, that's interesting. Listen, when we come back, Thomas, I'm going to ask you about some of the regulatory barriers and what potential is in the sector when it comes to changes that can help patients. We'll be back with more right after this commercial break.